and I don't think anyone has said differently. There was always a likelihood that diseases, we have said it, would spike, and there would be flare-ups of the virus, because until the virus is gone, there's always a chance of flare-ups. Countries in Europe deserve a lot of credit for the work they did, and particularly their populations did, to suppress the virus. But it's not suppressed throughout all of Europe, and there are significant issues still with transmission in parts of Central and Southern Europe that still remain to be fully under control. Countries in Western Europe in general have suppressed the majority of virus transmission and are now seeing flare-ups of that disease. The trick for them now is to really focus on identifying those clusters of disease, identifying any new community transmission, and putting in place the kind of localized measures that can contain the virus, suppress the virus, and reduce exposure, and try to avoid, if possible, having the sort of countrywide lockdowns that had did so much economic damage before. That does require a very sophisticated approach. It requires very localized data. It requires very rapid turnaround of testing. It requires very fast investigation of clusters and the implementation of measures as localized as possible. That will be what countries in Europe and countries around the world really need to focus on, is how fast and how speedy, how effective is your response to those inevitable flare-ups, and are you able to shut down transmission as quickly as possible and move on to the next flare-up. And I know that's not what people want to hear, but that is the reality. Once you get the disease down to a low level, you will have flare-ups. What you do about those flare-ups and how localized you can be in the surgery that's needed to remove the virus really comes down to how well you've invested in your ability to do surveillance, to do quarantine, to do tracing, and do all of those other things. So no, I wouldn't characterize, everyone's been speaking about waves and spikes and everything else. The reality is that, and I've said it before, that in a classic epidemiology of viruses, in the absence of control measures, very often viruses can show seasonal patterns. We've certainly seen that with influenza. This virus has demonstrated no seasonal pattern as such so far. What it has clearly demonstrated is, if you take the pressure off the virus bounces back. That's the reality, that's the fact. You can call that a second wave, you can call that a second spike, you can call that a flare-up, you can call it anything you like. Take the pressure off this virus, the virus will bounce back. And that's what we will say to countries in Europe. Keep the pressure on the virus. The DG said it, suppress, suppress, suppress.
If I could just supplement that. So just to say, I completely agree with everything Mike has just said there. Just to answer the second part of that question. So you used the word, what is to blame in your question. And I think we need to avoid the use of the word blame here, because what we are seeing and what we have expected and what everyone should expect is that this virus likes people, it likes an opportunity to spread. And if we give it an opportunity, it will. So what we're trying to express in beyond the all of government, all of society approach, strong leadership, clear national plans, strong local implementation, especially where it is needed, is to empower communities. We would like everyone on the planet to understand what their role is in this fight against COVID-19, to manage your own risk in terms of what you do every day, in terms of deciding if you can. If you are asked to stay home, please stay home. But if you do need to leave your house to do different things, to follow the national guidance. If you're asked to wear a mask and you go in shops or you go on public transportation, please do so. If you could avoid crowded places, if you could avoid indoor settings with poor ventilation, manage your own risk. Reduce the opportunity for you to become exposed to this virus. Because not only are you preventing an opportunity from yourself from getting infected, you prevent the opportunity for this virus to pass from you to somebody else who could potentially be in a more vulnerable grouping. So again, we're still learning about this virus, but we know that if the virus has an opportunity to spread, it will. And it hasn't gone away. As Mike has said, there is no indication that there is seasonality with this virus. The virus is still circulating. We know that the majority of the population still remains susceptible to infection, and so we have to do everything that we can to prevent infections and save lives. So do it all. Physical distance, wear a mask where appropriate, make sure you practice respiratory etiquette, avoid crowded settings, follow national guidance, be informed. All of this needs to be done every day.
Thank you very much, Dr.